We are very thankful that we were able to share this Inmotion crib for colicky babies. So Mark, do you want to tell them the history of why you started developing this?
The history on this crib was when I was working in the medical field with the physical therapists and occupational therapists. We had a physical therapist who, her baby was colicky, and she asked us to build a crib that had motion to it and more or less the sound, and try and get the sound of a heartbeat, a really low sound. So we did that for her colicky baby, and it actually worked really well. So once she did that, they actually came to us and said, well, this crib will also work for several other things.
So when I worked in the hospital, I was a respiratory therapist, and working in the neonatal unit, there were a lot of babies, unfortunately, that were born with fetal alcohol syndrome. Some had some brain injuries. We had some babies with cerebral palsy, some blind babies, and some deaf babies, and they needed that motion just to calm them down. And so putting them in a crib like this, it actually, again, with the motor, the soothingness, but also the motion, for some reason it helps stimulate the brain. So then that way the parents can sleep, the child can sleep, and the development, because when they're in this, they're not uptight. And so when you have physical therapist and occupational therapist working with a baby or with a child, then they're able to help build up their strengths. So when we started our company, it's Inmotion. So this is the Inmotion crib, and we're wanting to get everybody back into motion, whatever that motion is for them. Our hope is that we're being able to give them some relief of knowing that getting, again, back into motion and giving the parents some hope and some relief. Sleep, as we know, also heals the body. So I think that is our hope and our desires, that we can reach so many families knowing that they don't have to be sleep deprived from not being able to help their babies. And then also, like I said, with their development, their babies being developed and the child being able to be developed and having physical therapy and occupational therapy. So our hope is that they can live a higher quality of life, being able to be better in motion.